broadly, there are three questions that we're asking. The first is, how did we get to where we are in industrialized nations? How did technology shape a healthcare system? How did it impact affordability, insurance, the model of care? Right? You have to understand the basics before you get to the future. You have to understand the past before you get to the future. So once you have that baseline understanding, the question is, okay, let me pose a scenario where there is a healthcare problem that has been addressed really well in a country like the US, yet it's still a major problem elsewhere. So if you know everything and that solution to that problem has already been established, why isn't it being used everywhere? That's where an engineer can make a big difference. And that's a good place to start because it's much harder to develop something new that no one has envisioned. So like if you want to build a new therapeutic. But here, it's a low-hanging fruit. So why don't we start with that and build a systems way of thinking to address that. Then from that point, it sort of goes to, okay, what are the opportunities in technology innovation? What has been done? And how could these solutions, if you were to now put them in the context of healthcare, change fundamentally the way care is delivered? And that's happening globally, but that's not happening in the US. So bringing examples of that into the conversation. And the third part is, okay, you have technology, great, but how do you make decisions about what to do for the patient? How do you communicate? How do you analyze? How do you ethically interpret that data so that you can give the best care? So we know that AI is very popular now in addressing a lot of healthcare issues. Can we use that to create a robust method to help providers make good decisions? And how do we make sure that they communicate it to the people that they need to communicate it to? So those are the three parts. You know, what inspired or led to the health system we have? How can we think to the future? The sustaining disruptive innovation model. How can we move towards disruption? And how can that disruption or the disruptive technology then allow us to make care decisions that would be as effective, if not more effective, but the underlying goal is to make it more accessible.
I think I'm particularly proud of the way that the machine learning and AI chapters came together. I think those, we really tried to provide a lot of technical context there, but also a lot of societal context around the importance of ethical development of AI. And so I think, you know, in general, that's kind of a theme throughout the book, is we really tried to tie in a lot of ethical considerations of technology development. And so I think that's something that, you know, I'm particularly proud of about our book, is that I think it takes a very unique perspective on including the ethical considerations of technology development that maybe aren't covered in a traditional engineering textbook.
The whole idea is to emulate what's happening in the real world. You're not siloed anymore, maybe in the past, but you can no longer function in a silo. People have to work together. The problems are more complex, they're more nuanced. You can't say, well, I'm going to do this and only this. And so if you're teaching this at an undergrad level, and ideally before students become seniors, they have either covered material in those disciplines, or they have yet to know that the classes that they're going to take might cover those disciplines. So why not give them a chance to get the big picture if they have yet to take the classes, or reinforce what they've learned, but put it in a context that they may not have realized. So I think of it as a bridge between, you know, either as a way of anticipating how classes can fit together in a more systems level, or how what they've learned could be put to use in a way that they hadn't envisioned.
I think that we see all engineering programs, benefiting from incorporation of a course like this, whether they even have a biomedical engineering program or not. I think that the concepts in the book can be applicable to a variety of engineering disciplines. Even straight, electrical engineering can be used in medical device development. There's components of that in medical device development. And so I think, regardless of what engineering curriculum is being taught, there's absolutely a benefit for adding some sort of course that incorporates this idea of, thinking about the end term, the end user, and the goal, and what the ultimate implications of your technology development are going to be. Particularly thinking about the Millennial Development Goals, the Sustainable Development Goals, as good metrics to sort of be weighing your coursework against whether you're training your next generation of engineers to fit within those or work towards those.
As Brian mentioned, there are various components of the book. He talked about the ethical component. There are also examples, and there are homework problems. So definitely the solutions to the homework problems are provided. In addition, we teach this course, and we're creating the materials to teach the course. And that is dynamic. That's not a static process. In fact, when new material is available, that is added. And so you can think of the book as a scaffold upon new layers of information can be added. So we plan to disseminate those slides for the instructors to use. And I would say that there's also the just-in-time, as material evolves, labs or, open-ended questions or case studies, all of those could be continually added to that repository of resources that instructors and students can access.